We've all heard stories of people who have died suddenly from a severe allergic reaction. And these stories are definitely frightening. But fortunately, events like this are very rare, with less than 1,500 deaths from all age groups and all types of allergies in the United States. Statistically, this is a very small number compared to approximately 50 million Americans that actually suffer from some form of allergy. Unfortunately, recent studies show that allergies of all kinds are really increasing in developed countries. And though nobody really knows why for sure, one prominent theory is that we've developed too clean a lifestyle. With the constant use of antibacterial soap, hand sanitizers, and airtight modern homes, our body's immune systems are just not developing and fighting germs in the same way as they did in the past. This can lead to overreactive immune systems. Finding a balance between healthy living and clean living is definitely a must. Some other theories include overuse of antibiotics, excessive immunizations, highly processed foods, and environmental pollutants that have all led to the breakdown and confusion of the body's natural immune systems. Whatever the cause, the reality is that more people are developing allergies than ever before, and we need to be prepared to handle emergencies from allergic reactions. Food and insect allergies are the most common causes of severe reactions that happen outside of the hospital, with food allergies being the most prevalent. Children tend to be the most affected, according to the Centers for Disease Control and Prevention. Between 1997 and 2007, in the United States, the number of children that have food allergies rose 18%. Fortunately, most children outgrow food allergies by adulthood, although peanut allergies tend to be lifelong. You might be thinking, so what causes an allergy to develop? Well, the immune system normally defends the body against things that can be dangerous to your health, such as viruses and bacteria, and a healthy immune system keeps a person from getting sick when harmful germs find their way into the body by attacking and destroying the germs. An allergy results when the immune system mistakenly targets and overreacts by attacking a normally harmless substance that has been eaten, inhaled, injected, or contacted the skin. And this substance that causes an allergy is called an allergen. Now, an allergen may have been introduced to the body many times before with no trouble at all, but at some point, for some reason, the body flags it as an invader and triggers the immune system to attack the allergen. The body will remember that specific allergen by producing antibodies that will be ready to go into action to attack it if the allergen enters the body in the future. This is the reason that an allergic reaction is often more severe the second or third time it happens. And when the immune system attacks an allergen, high quantities of histamine and other chemicals are released into the surrounding tissues. Now, depending on the part of the body involved, the histamine and chemicals can cause itching, hives, rash, sneezing, wheezing, swelling, runny nose, nausea, etc. But a serious allergic reaction that can be life-threatening is called anaphylaxis. And this is a severe sudden reaction that affects many parts of the body all at once. And it typically begins within minutes after an allergen is introduced to the body. This severe allergic reaction can cause the blood vessels all over the body to dilate. In other words, open all the way up and cause anaphylactic shock. The full opening up of the blood vessels causes a sudden drop in the blood pressure, and the brain and other vital organs become oxygen starved. Anaphylactic shock will cause death if not treated. The treatment is epinephrine, which helps constrict the blood vessels and open up the airways. The most common things that cause anaphylaxis are foods such as peanuts, tree nuts, fish, shellfish, eggs, and milk. Biting or stinging insects such as bees, latex, medications. Food is generally the most common cause of anaphylaxis, with peanuts being the most common cause of fast, severe, and life-threatening reactions. Because severe nut allergies tend to affect children, a lot of fear is associated with nut allergies. It's become a very popular and emotional topic. And this is the reason that many schools, airlines, food manufacturers, and other places have become nut-free zones. More effective than banning nuts completely, there are precautions that public facilities can and should practice, such as having nut-free tables at lunch for children to eat. Most importantly, children need to be taught what foods to avoid. Children with allergies need to carry an EpiPen. Schools, daycares, camps, and other places that typically serve food to children should have EpiPens for emergencies. Preventing an emergency is the best, but if an emergency happens, you need to know how to recognize it and be prepared to handle it. The following signs and symptoms would indicate a person is going into anaphylactic shock. They're having trouble breathing. They're wheezing, tightness of the throat, swelling of the face, eyes, lips, or tongue, hives, itching, flushed or pale skin, a rapid heartbeat, low blood pressure, nausea, vomiting, or diarrhea, dizziness, fainting, or unconsciousness. Now, children may describe their symptoms in the following way. It feels like something is poking my tongue. My tongue is tingling. My mouth itches. My tongue feels like there's hair on it. My mouth feels funny. There's something stuck in my throat. My lips feel tight. My body feels weird all over. Now, if you recognize any of the signs and symptoms of anaphylaxis, don't wait for signs and symptoms to get worse. Call 911 immediately, and if it's available, assist with or administer an auto-injectable epinephrine pen, such as an EpiPen. Keep the person calm while waiting for the ambulance. Let the person sit in the position that's easiest to breathe. Typically, this is going to be sitting up and leaning forward. And if the person feels faint or is not fully conscious, lie the person down, elevate their legs, and keep the person warm. Talk to the person to reassure them. Keep the person's airway open. Monitor their breathing and be prepared to start CPR if the person stops breathing and becomes unresponsive.